We are recording. All right. So as we approach our summit, I kind of wanted to dive a little deeper into the CNC and what it is and why we're doing it. Um, so as you may or may not know, my position is funded by the CNC grant. That is the Colorado National Collaborative Grant. And so it's a partnership of local, state, and national scientists and public health professionals. We are working with health and social service agencies, nonprofits, um, businesses, academic organizations, et cetera, to promote and implement a comprehensive approach to preventing suicide. So all of our partners will channel their resources to the same goals and avoid duplicating efforts. And we enhance each other's work to produce lasting change. So there are a couple different counties that are part of the CNC program. There's us with Jefferson, Clear Creek, and Gilpin. I believe there's also El Paso County, Larimer County, La Plata. They picked the counties that would receive this grant based on suicide rates and statistics. So we have been chosen this year, and this is our first year implementing this. So that's why things have been a little bit rocky, and I've spent a long time trying to understand fully this grant and just the CNC framework in general. So I appreciate you all for bearing with me. So the CNC defines a comprehensive approach to suicide prevention with a public health approach. And it is data driven, and it's prioritizing promising programs, practices, and policies for populations and settings across all age groups to include individuals, families, communities, and systems. Okay, so that is the CNC, and our goals overall to create a comprehensive suicide prevention model to reduce suicide rates statewide, but also specifically, we would like to reduce state suicide rates by 20% by 2027. And that is a hefty goal. And as that maybe it isn't enough time to achieve 20%, but as close as we can get, the better. So the framework for CNC involves these 6 pillars. We have connectedness, economic stability and support, and access to lethal means safety, education and awareness, postvention, and access to safer suicide care. And so under all of these pillars, there are a bunch of different strategies on how we can implement these pillars into our work and just be conscious of them and be thinking about them whenever we are doing our work. And so with this framework also comes evaluation. So that is the data collection process. We have experienced just one time about, I think it was in March that I sent out that survey. So those surveys are going to be sent out every quarter to try and collect some data, and they should remain relatively the same. I may add a couple things here and there, but so the CNC, which is run by the Office of Suicide Prevention, the state, so they record all of this data and they analyze to see where the gaps are, where folks are struggling in different counties, and really where the work needs to be done. So ultimately, suicide is a public health concern. So some of these questions do address public health issues that maybe don't seem to be correlated as much with suicide prevention. For example, I know on the survey, there are questions about hosting roundtables to support transportation, access to quality childcare, housing, food insecurity, all sorts of things that aren't directly related to suicide prevention, but are absolutely protective factors. And so that is something we're trying to look at and see Because if we have those measures in place as they relate to the pillars, so like, for example, economic stability and support, that's something that has been a pretty difficult pillar to integrate. And for like lethal means safety, that's like, do we do drug take back days? Do we have information on safe firearm storage? So it's things like that that all tie in together as a larger public health problem, seeing as suicide is a public health concern. Um, Now, some of those questions are rather vague, and I am working with the OSP team and with our CNC committees to better understand and find ways that I can better relay the information that they're asking for. For example, I know one question that I got a few questions about was does your organization have best practice suicide policies in place? But that's pretty vague. That could mean a number of different things. And to be honest, I didn't even really know what that meant when I first looked at that. So that is going to be something like, do you have gatekeeper training for your staff? Do you have prevention resources available? Do you have an action plan, a safety plan in place for employees? So it's going to be things like that. And I will be, after our next evaluation meeting with the full CNC team, I will try and get some more clarity on that as well. And if you have any questions on that survey, please let me know. And I know that a lot of folks were not able to fill out a lot of those because there just simply wasn't an answer to that, or you're not really sure how to find that information, and that is totally okay. Like I said, this is our first year implementing this, and so there's a lot of things to be learned. And there's a lot of room for error for right now as we just figure it out. But also 0 is data. If you answered like 0, you didn't host any roundtable events for housing insecurity, that's okay. That is a good data point and it's important. So yeah, don't worry about if you can't fill those out. That is what we are going to work on doing together throughout these next 5 years with this grant. Are there any questions so far about CNC and the evaluation process? Oh, okay. Awesome. Now moving on. Okay. So we have been suggested by our web developer that is working on our new website, which updates on that to come in a second. She has suggested that we create a logo. And I think that's a great idea. I think we should have a logo. Now I took the liberty of just sketching these up really quick. So I'm not a professional graphic designer. These you may not like any of these, and that's okay. And I will continue to tweak them. I'd love to hear your feedback, but I also have a poll for us to take. Give me 2 seconds while I figure out how to do that. Here we go. Okay, so I'm going to set up this poll and let me know which one you like best. Or if you don't like any of them, also let me know. And please feel free to come off mute or throw in the chat your thoughts on any of these. Again, I'm not a graphic designer. We can have a real graphic designer create a logo for us, or if any of y'all know someone that would be great to take on this task, let me know.
Rachel, I see the poll, but not the logo options. Is that something I need to share?
No, it should say option 1, option 2, option 3 on the poll. And then does it not say that under the photo?
I see the option 1, 2, and 3, but not the photo. Oh, you see it on your screen? Okay, maybe it's me.
Is anyone else having any issues with that? No? Okay, great. Okay. And it looks like most people are liking option one. That is also my favorite one. Um, any comments, concerns, anything you'd like to change on that or add to? Nope.
Rachel, I
Okay.
put a comment for you in the chat, just an FYI.
Oh, great. Okay, I see. Yes, spelling out the acronym. Yes. I was thinking about that as well because this is a rather long acronym for us. Um, I did have some rough drafts where I tried spelling it out and I couldn't fit it quite how I liked it with all the words. Again, like I said, not in marketing, not a graphic designer. Um, but I agree. I think that having it spelt out.
Yeah, and you could literally put it under the logo mark itself. So you could still have the SPCJCCG on the top and just underneath your mountains, spell it out underneath the mountains, right? So then and you could literally just put it in block format underneath the mountains so that you've got all of it on there.
Yeah,
Just a
I
thought
like
for you.
Yeah, no, thank you so much for that suggestion. I really like that. And Sandy as well, spelling it out in a circle. I like that idea as well. It would probably be a full circle with all the words in that, so it could encompass the entire thing. Um, I like that. Thank you for your suggestions. I will make those changes, and I'll send you all a copy of that if we like whichever one, and we can vote on that as well. Um, yeah, I will do that. Any other comments, suggestions for the logo? Okay, great.
Rachel,
Oh,
I'll just add we can work on spelling out the acronym, and if we need some help, we can work with our graphic designer just to tighten it up or maybe rearrange the words or whatever. I think that we can definitely get that if we need it.
great.
However, yeah.
Yeah, perfect. Yeah, we probably should run it by a professional graphic designer. Canva can only get you so far. All right. Well, great. Thank you all for your feedback. Um, Now about the website. So I know that this has been in the works for a long, long time. And currently Jefferson Center, which we were running the website originally, we have moved all of our old website items onto a brand new, more user-friendly website. But in that process, a few things did get lost and just not, we're working on finding kind of the back end info for that old website. So currently it is down, but hopefully that's something we'll fix quickly. I am working with a web developer to create a brand new website. This was something, if you're in the training for all action group that we had, this is something we were discussing for a little while. We have created the account. We are just trying to get our old URL back currently. But I do have a little rough draft for you all of what I would like it to look like. And I'd love to hear your feedback and thoughts. Again, this is very rough. It probably won't look exactly like this on the site, but this is kind of what I've had planned out so far. So this would be our fun little, the top of the page. I think that picture is beautiful, and I will be using that for everything going forward. And then just have, this would kind of be underneath that mountain photo, I think is like the first page. Not sure, I didn't think I could make that one page on Canva, but this would be that one page with all of these buttons for our different pages. And so this is, as you can see, blah, 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 link to their site. This is all a rough draft, but this is how it would be for our partner orgs. We'll have every organization listed, and something I am going to ask of you once this is up and running is just a short little blurb about your organization. and how it relates to suicide prevention. And that will just like a quick few sentences right under like Centura, for example. And then there's a link to your website so that folks can learn more about all of our organizations. And then
we're on the last slide. So we can't see the current slide with the website.
I'm sorry, which one do you?
We're on the website slide that says training calendar and about our orgs, but not the actual website page. Like it's not in slideshow mode at the moment.
Yeah, it's I'm just showing my Canva, so this is like the editing. Like, what do you not? Oh, sorry. What is?
We can't see that at all, Rachel. So we're not seeing your slide 10 at all.
Oh,
we're seeing the slides, but not the Canva page.
Oh my goodness. Okay, let me stop sharing and figure that out. I apologize. Okay, how about now? Yay, okay, I am so sorry. I was just blabbing at you and you have no idea what I was talking about. Okay, so here it is. This is my rough draft for the website. So this first mountain page and this statistics page, and with all of our different tabs, this one and the mountain one combined would be like the front page. And these statistics I might tweak. I don't know if I want to keep those specific ones. Again, rough draft. And then for the partner page, like this is how it would look ideally with the name and then blah, 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 your little blurb, and then the link to your site. So that would be there for all of our partner orgs. So that's what I would ask of you all. I'll probably not for another month or so, but yeah, I'll just ask you all to provide a little blurb for me. And then we'll have resources. This is just one, obviously, and we will all agree on which resources we want on there. We did have our resources listed on the old site, so we might just add all of those and then take a look and see if they're still active and good resources to have. Then we'll have a page for the full coalition meeting. This will be like, imagine that this is the YouTube preview screen. And then there'll be a link to our YouTube channel that has all the recordings. That's where this one will live. And this will be obviously a lot larger and just contain all of our full meetings on there. And then for action groups, just like our previous ones were the training for all action group and burnout prevention action group. This is where they will live now. They will have their own page, and we will determine what those will be at our summit. So something what we will do once these groups are established is create an action statement in our goals, so that we can have that listed there, and we'll have our meetings, and any materials that we create from those groups will live on this page. So next we have our training calendar. This is what has been in the works for so long. So we'll have our little blurb here about all the different trainings that we offer, and it will be updated monthly. And I'm going to color code it and have a key so folks know. It will probably be like QPR, mental health first aid, assist, CAMS, safe talk. I'm thinking, depends what we're all offering. But those are just suicide prevention, more specific trainings. And so another ask for all of you, if it's not too much, is to just send me a quick update once a month on what trainings you have available and just a couple details, where and when. And yeah, they will all just live in one place so that folks that are looking to get trained can have a lot of different options within our 3 counties. Then we will have an About Us page. We'll all write a blurb. We can all collaborate on a blurb. And then a Contact Us inspirational quote. insert here. Yeah. So that is what our website will look like once we get it up and running. Are there any questions, suggestions, comments?
We have a mission and vision, right?
Yeah.
That will go on the About Us site. And then another question I had about was the calendar. Rachel, are you going to have to populate all these events, or was there a form that folks would fill out that would then go to you to vet to then publish?
For folks to sign up for trainings or for?
No, to list them. So say I'm providing a mental health first aid, I go to your website, I fill out information, the address, how to register, and then it could go to you, you vet it, you know me, you know it's a legit class, blah, 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 and then you publish it versus you. Or are you going to have to, I guess my thing is, I would advise to make this simple for you and
Yeah.
for the community to submit classes on the site.
Yeah, so my plan was to send out a survey once a month and just have you all fill that out, and then I would manually put it onto the calendar. We've had a couple discussions with our web developer on how exactly we want the calendar to work, and I think the best way that we have come up with for now is for me to manually do that, and I don't mind doing that. I feel like I want just some quick questions I think are okay. And then maybe provide like a link to the organization website on that calendar date. Does that kind of answer your question?
It does. As long as there's a way, I think, for people to click and register.
Mm-hmm. Yeah, and that is the plan.
And then, you know, I'm working on another calendar for another suicide prevention group. So just how you can get more people submitting and populating this calendar and then to make it easy for you.
Yes. Yeah, and that I appreciate that. That might be kind of a work in progress, and we'll play it by ear and see how it goes when we first get this up and running. But yeah, so far my plan is just to send out a survey really quick, have y'all figure it out or fill it out, and then yeah, just have a link to register or just a link to the organization's website where you can find it. Okay. Anything else about the website?
One thing I just want to add with regard to being able to register, because our web designer was asking about this, is, it's not registration through our site or through Jefferson Center at all. It would be a link to your class's Eventbrite or whatever you're using for registration, is what we want to include there. And also, I love the mountains, Rachel. I think that's a beautiful picture, and I love how the colors kind of tie in with the suicide prevention colors.
Thank you. Yes, this photo, I've been so obsessed with it. I made it my LinkedIn header and everything. I love it. Contacted the photographer. She works at Colorado State University, and she has a million amazing photographs of our beautiful state. And yes, they do tie in with the purple and blue. So yes, that was intentional. Thank you, Christy. All right.
Sorry, did you say that this is going to be independent on its own website, or it's still going to be embedded in the JCMH?
It is not going to be embedded. Yeah, that's what we wanted. That's why we initially wanted to move it around. And I know that the old website was, it was kind of just one page. So it was pretty simple, and adding in a calendar into that seemed like a heftier task than creating an entirely new website. So yeah, we're working on it on our end to find all the old info from the site and how we can put all the new info in our new website and our new platform and not have it be associated with JCMH for a variety of different reasons. Because this isn't, while this coalition is facilitated by me, a Jefferson Center employee, this isn't a Jefferson Center initiative necessarily. Like this, it's bigger than that. So yeah, we don't want it.
A little more on that. So the URL will be the same as it's always been. And so we will keep that. And then, as Rachel mentioned, Jefferson Center had to move, switch platforms for our website. And so this was just an opportunity for us to have it be sort of standalone with the same URL. There's just been some kind of unforeseen tech issues with Rachel mentioned that we are working on diligently, and appreciate Rachel's diligence with trying to figure all of that stuff out.
Yes, thank you, Christy. Yeah, it has been a process and a half. Let's leave it at that. All right.
Rachel, I also just caught this. I mean, just came across my mind here. Anytime we're identifying as a suicide prevention resource, it's just a way to direct people to crisis supporter resources, so they don't have to click multiple times. I think that might be helpful just to put something on the homepage that directs people to that resource.
To crisis
so whether
services?
it's to crisis services, whether it's the crisis line or just some mention of, if you're in crisis, get help, click here, something related to that.
Yeah, that's a great note. Thank you. Yeah, and I think that it could live right here on this, since this in the mountains is going to be like the first page. Yeah, I think this would probably be a great place to put that. And like I said, I don't love all the statistics that I chose. I don't, so I could replace that and add the crisis services on there. But yeah, thank you, James. That's a really great suggestion. I'll make sure to include that once we have this up and running. All right. So that is the website. Hopefully we will get this up and running sooner rather than later. And now on to the most exciting part. Me, along with my wonderful planning committee, have set a date and time and place for our summit this year. Woohoo! Yay! So it's going to be on Wednesday, September 13th at the Wheat Ridge Rec Center. It's going to go from 9 a.m. to 1 p.m. with coffee and snacks and lunch provided. There is a QR code right there that you can scan to sign up. And then there's also a link to the Eventbrite that Christy will throw into the chat. So we'll have that, and then I'll also have her throw in a copy of this flyer in the chat so that you can share with whoever you think would like to attend. Please spread the word. We have a large capacity, so we can fit a lot of people. But yes, very, very excited to get this started and to set our new priority areas and pick new action groups. Yes, we're very excited. We're still, it's a work in progress, figuring out our agenda and everything, but we will have a full agenda available closer to the time. We'll also be asking for volunteers to be facilitators. And that's something that we will also, we'll ask for that later on, but just so you have that in the back of your mind. Yes, if you have any other, any accommodations, please let me know. My phone number is down there in that email. You can reach me there as well, or my personal email. So yeah, this is great. Very excited. We got the link in the chat. Oh yes. Okay. Awesome. Any questions about the summit? Oh, okay. Well, throw this on your calendar, folks. Really exciting times.
Hey, Rachel?
Yeah.
Just curious, do you have like a media point person that's gonna be creating press releases, or that's gonna make this more public facing, an opportunity really to use this event as a way to say, hey, we're a coalition, here's what we're doing, here's what we're about, moving forward, we want to really engage the community?
Yes, that is something that we are planning to discuss in that planning committee. And we will, yes, we will definitely have some marketing and advertisement towards this. And also, if any of you folks feel free to share this in any way, shape, or form. Here I am throwing out the flyer in the chat so that you all can save that. And I will also include that in the that with the Eventbrite link. I will include that in our follow-up email.
Thanks, Rachel, for getting the flyer in the chat. It was telling me the file was too big, so appreciate that.
Technology has not been our friend today. Right.
And if we send this out also, are we not, I'm trying to be clear, like who the target audience is for this event, and is it anyone and everyone, or is it going to be specific so we can make sure if we're disseminating this, we have the right folks in mind?
Yeah, so this is it's mainly for all of us, for our coalition, and anyone that would like to join. So this will be, I think the best audience for this is going to be anyone in our 3 counties that cares about suicide prevention. But we can also have some folks outside of our counties that are passionate about this and would like to know what's going on in their neighboring counties. So that is generally the audience. I wouldn't say it's necessarily just anybody and everybody who wants to, just folks that that are passionate and, you know, are related to the work in some way, shape, or form. And any folks that would potentially like to join the coalition, that would be the best time for them to join as we set our new priority areas. So yeah, does that answer your question?
Yeah, I just think it might be also helpful, like if I was going to send out an email, that we can provide some examples of who we're looking for as far as community partners or stakeholders. You know, obviously folks involved in public health and mental health, and but who in addition? Like, I know we have a deputy coroner on the call. Like, who else would be the settings or sectors that we'd be looking for to attend? So that way we can kind of push that out as opposed to trying to, to everyone, but maybe some exceptions here and there, but it could be a little more targeted.
Sure, yes. And I can work on I can write up a little blurb about our target audience. But again, really just mostly I would say your colleagues and connections that are doing similar work as all of us. I think those would be the best folks, but also just yeah, I can be more specific and I can write up who our audience should be. I see Laura, thank you so much for joining us. Yes, so I will do that and I'll send that over. I'll include that in my follow-up email.
Awesome, thank you.
Yeah, but also feel free to use your best judgment. You know, whoever you know is passionate about this and regularly does work in these areas or anything somewhat related. Like Annette, our lovely Jefferson County coroner, definitely her job isn't like directly suicide prevention related, but there's definitely some overlap there. So she's a great person to come to this. And all other coroners. Yeah, any other questions on the summit? Okay, great. So believe that is all I have for you folks today. It's a little bit shorter, but
Rachel? Sorry
yeah.
to interrupt. You said questions and I couldn't unmute in time. Is this flyer, have you emailed this to us yet, or do we just download it, or?
I have not emailed it to you yet. You're seeing it live now. I will include it in that email as an attachment. It is also in the chat if you want to download it.
Okay.
Yeah, I will include it. Perfect. All right, so I will send let me stop recording.